Another form of acquired heart disease is Kawasaki's disease. This is acute systemic vasculitis. The blood vessels become inflamed. Coronary artery aneurysms can form in the heart of some children with this disease. This is from an unknown cause. It may be an abnormal response to a common virus that most people do not react to. However, we do not know what the virus is. Some think it may be an autoimmune disorder. It's named after the doctor who first described it in 1967. Before then, it was misdiagnosed, and it's often misdiagnosed today. It's diagnosed based upon clinical symptoms and lab values. Treatment is crucial to begin before the 10th day of the fever onset, and this helps prevent aneurysm and heart valve problems. Frequent echocardiograms are performed to check for these problems. First line of treatment would be high doses of aspirin along with IVIG that needs to be ran over 12 plus hours. Most children will respond to the first treatment. If they do not respond, another dose of IVIG is initiated and continue with high doses of aspirin. In rare cases, a rheumatologist might need to be consulted for additional treatment. In later stages of Kawasaki's disease, the hands and feet will peel, often in large sheets of skin. It's most common in the age group from 1 to 5. Males. If parents have had Kawasaki's disease, and it's more common in the northern hemisphere in between the months of January and March. Assessment findings. The acute phase, the child will run a fever for 5 days or longer. If a child runs a fever for 5 days, it should be a red flag. You should consider Kawasaki's disease or syndrome. It's a high fever that does not respond to medications. There will be red eyes with no drainage, a strawberry tongue that is specific to Kawasaki's disease, red mucous membranes, non-blistering rash, and bilateral joint pain. In the subacute phase, the fever will resolve. There can be peeling of the skin around the nails, palms, and soles. And you wanted to monitor for complications because it's most common in the subacute phase, coronary artery dilation or aneurysm formation. Then there's a convalescent phase where there's altered lab findings, and resolution usually takes 6 to 8 weeks. However, irritability may last up to 2 months. Arthritis symptoms last several weeks. And the skin may be tender. Lab values, there's an elevated CRP or ESR. Serum albumin will be less than 3.0. CBC will show anemia, increased white blood cell count, increased platelets, and the platelets is usually after 7 days of the illness. Care of a child with Kawasaki's disease. Vital signs, cardiac monitoring, assess for signs and symptoms of heart failure, INO, daily weight, nutrition, the IV gamma globulin, aspirin, comfort techniques, and passive range of motion. Comfort techniques could include oral hygiene, cool cloths, skin lotions, calm environment, cluster your care to promote rest. Avoid live immunizations for 11 months. They can have an increased risk for the infection, so live vaccines are to be avoided. They'll be given IV fluids to prevent dehydration. The IV gamma globulin is to prevent aneurysm caused by the weakening of the main artery. The IV gamma globulin is a sterilized solution made from human plasma. It contains the antibodies to help your body protect itself against infection from various diseases. It's IV administered within the first 7 days of the illness and repeated if the child remains febrile. High-dose aspirin, such as 80 to 100 milligrams per kilogram per day, is to be given every 6 hours until afebrile. Then it's decreased to 3 to 5 milligrams per kilogram per day and continued until the platelet count is within normal range, which may take 6 to 8 weeks. This slide just talks about aspirin, ibuprofen, or other platelet receptor inhibitors is prescribed to decrease inflammation and prevent platelet aggregation. The IV immunoglobulin reduces the immune response, and this is telling parents to caution against routine live immunizations while on IVIG or immunization will be ineffective. Steroids are also contraindicated because they may increase aneurysm formation. If the child is left with coronary artery disease from stenosis or aneurysms from the coronary arteries, a coronary artery bypass surgery may be necessary in the child's future.